Assalamu alaikum, welcome to another episode of HealthWise. I'm Dr. Tahira Shahid. It's good to be sweet, right? Sweet in your demeanor, sweet in the way you talk. But how much sweet is too sweet to handle? I'm talking about sweet in the blood, which is not a very good thing. So let's keep our sweetness to just being sweet in the way we behave, but we need to know what diabetes is. We've heard a lot about diabetes all our life, and by now people are very aware that the diabetic was the ones who suffered most during COVID as well. COVID was contracted by almost everybody, but in the diabetics, it proved really fatal. Now, why is it that diabetes is so uncontrolled? Why is it that we take it so easy? Why is it that we as people, start avoiding getting tested in the fear of having to take medication, whereas we fall for complications all the time? To discuss all of this in detail, we have invited into our studio today two very interesting doctors. Why I call them interesting is because we would have assumed that with diabetes, we would have an endocrinologist or a diabetologist only, but these are the ones who actually deal with the complications. So we have an ophthalmologist and we have a podiatrist who deals with the feet. Excuse my pronunciation. So we welcome onto our show the two distinguished doctors. So Dr. Tahir Masood, who's an ophthalmologist, and Dr. Kamran Salim, who's a podiatrist. First to Dr. Tahir. How are you doing, sir? The first things first. So when we talk about diabetes and its complication in the eye, people don't even go there. People don't even think it can affect the eye, though it's causing so much of blindness. So could you elaborate a little bit about how it affects the eye, how we need to be very careful about sugar control and everything else as well?
So thank you so much for inviting me. It's a pleasure being here, Dr. Saiba. So we know that diabetes is actually a global problem, a disease. It's on the rise. And especially in Pakistan, the numbers are astounding. So nowadays, we are being told 1 in 5 people in Pakistan, they are getting diabetes. So this is a huge, huge number. And then it's a multi-system disease. It affects the whole body. And the eye is a very delicate part of the body. So it affects the eyes in many ways. So there are some very interesting figures as well. So of all the diabetics, 1/3 will have this form of disease called diabetic retinopathy, in which the circulation of the retina gets affected. And out of that, that cohort of patient, a further 1/3 can go blind. They will have very serious complications. So this is quite a serious issue. All diabetics need mandatory eye examination because it affects eyes in multiple ways. So if I just start from simple problems, because it affects the nerves, diabetics can have dry eye that can sometimes become more serious. Diabetics are more prone to infections. They can have eye infections. Diabetics are more prone to getting cataracts. They will get cataract at an earlier age. There's a strange association between diabetes and glaucoma as well. So, this is this very serious eye condition in which you have raised eye pressure and you can go blind. And the other, the commonest condition is diabetic retinopathy, in which the circulation to the retina gets affected.
So we need to tell our patients that if they are diabetic, for example, how do we diagnose that they are diabetic? Because if they are having a lot of thirst, if they're feeling extra thirsty, extra hungry, and they're getting infections that don't heal easily, they're getting wounded all the time and doesn't heal as soon as it should be. Also, they're losing weight, or they're having headaches or feeling extremely tired. They go and they get tested for diabetes. But it's not enough to just get tested for diabetes or start on a diabetes medication, whether it's insulin or whether it is glucose lowering drugs. It is also very important to see if the diabetes has started affecting your eyes, your heart, your kidneys, or your nerves. And for that, it is very important to visit an ophthalmologist who's going to actually be checking your fundus and your retina and seeing if any sort of associated complications have developed. We will come to your symptoms, but before that, let's move to the podiatrist as well, who deals with the foot, because we see so many cases where patients come with gangrene, and the gangrene has really worsened up, and it leads to amputation. Imagine a young boy coming in with an amputated foot. It's going to be so disastrous. And yes, diabetes does affect the foot and the nerves. So what do you have to say about this? Why is it so ignored? Why do people not know about it?
Well, thank you very much for having me here. I think people in general are negligent here in our country. Unfortunately, people don't really take care, so it spans across all the different aspects of our lives. Whether it is wearing a mask or any precaution that
wearing
we are
a proper
asked to
shoe that's not ill-fitting.
Exactly.
Right.
So the thing is, in diabetics, it is an insidious disease basically, and if you give different ways in which we treat the diabetic foot ulcer, the very first thing that we have to do is offload the foot, offload the ulcer.
Okay.
No matter what you do clinically, you'll not be able to achieve any results, because in other parts of the body we immobilize them. For example, if we have a problem in our arm, there is a cut laceration, we do not have to put any weight on it, but unfortunately, according to the nature of the function of the foot, it is under pressure all the time, and that's the reason why when we're walking, we are not able to give the blood supply that is really required to heal it. And diabetes already compromises our blood supply, the quality of the blood supply, and the quality of how much oxygen it is carrying towards the wound area. So it is already compromised, and on top of that, when you're putting weight on it, then it is difficult to heal. And that's the reason why you have to first of all offload it. And
so offloading means for that period of time they're on bed rest, elevation, what is it?
There are different interventions. Okay. By offloading, we mean relative offloading.
Okay.
It does not necessarily mean that we are going to immobilize a patient and just ask him to stay on bed for the whole time.
So you put it on the other leg, for example, putting your weight on the other leg?
Exactly. We have casts, different ways that we cast the patient, so that the patient might bear weight on the foot as a whole, but not really exactly on the site of infection or the site of ulceration. So that is relative.
And how do they prevent further infections? Do they take like antibiotics orally, or do they apply some kind of good antiseptics and antibiotics on top of it?
I think we are a creature of habit, so we have to have preventive habits in our routine, and we usually we counsel the patients. We let them know that these are the ways in which you'll be able to prevent further ulceration of your foot. For example, you have to inspect your feet every day in the morning as well as in the evening.
And you don't keep furnitures with these kind of corners around the house,
absolutely,
right? So that you don't keep hitting. You don't keep hitting, and you make sure that there are no little pricks or thorns around. And wear some very comfortable shoes.
Exactly.
All right.
So the shoes have to have a very, when we go into the details of the shoe has to be wide. It has to have a big toe box so that your toes are not really cramped in the shoes. And then, of course, the inspection, as I said, if there's any change in discoloration. There is one point that I would like to emphasize here, is that a lot of patients try to either do it on their own. They don't really want to go to a doctor.
So don't debride it on your own. Don't try to dress it on your own.
It's really very risky.
Right. So moving on to Dr. Tahir, we all know about the symptoms of diabetes that I just mentioned. But when it comes to the symptoms that are affecting the eyes, like for example, is it really loss in vision, or is it becoming blurred, or is it some kind of pain? Because you mentioned there were different things like glaucoma, raised pressure. So how do you differentiate what symptom is, is pointing to what?
Yeah. So the important thing is, when diabetes is affecting the eyes, in the initial stages, basically there are no eye symptoms at all.
Okay.
So that is the key thing, that the essence is screening and early detection. So that is the reason all the diabetic societies in the world, they advise patients, once you have been diagnosed, even if you have no eye problem, you must go to an eye doctor. So that is the take-home message. But as you know, eyes, the function of the eyes is vision. So as things progress, once some complication has set in, for example, if you are developing a cataract, you will notice blurring of vision.
Okay.
If diabetes is affecting your retina, we were using this word retinopathy a lot. So basically, it's either blockages in the circulation.
So you see floaters or no?
No. Basically, you will have poor vision.
Okay, just poor
vision.
So
the way it affects the retina, either you will have blockage in the small blood vessels or leakage from the blood vessels. In both cases, gradually, it's a slow process. Your vision will begin to deteriorate. So as Kamran was also mentioning, we have a very laid-back attitude to health. So,
and then we go to the optician. We think fixing glasses is going to fix our eyes.
Yeah.
Can you please clear that? A lot of people go to these glasses shops, and the optician makes them sit in front of a machine where he just checks their number, their refractive error, and they believe they've been to an eye doctor. So can you please tell them that no, an ophthalmologist who's going to use a fundoscope, retinoscope, see those capillaries or whatsoever, is actually going to tell you where they are?
Yes. Nothing against our optometrist colleagues. They're very well trained. I have a lot of friends in town, so they know when to refer patients to us.
That's good.
But it's important.
But provided he is an optometrist, because most of the glasses
some
shop
of them
owners
will
are
not
not.
be. Some of them will not be, and it's important for the patient to know at least what they're up to. So basically, your refractive errors are different. If you have a problem of eye focusing, for example, if you're short-sighted or long-sighted, you will only benefit if your retina is perfectly healthy.
Okay.
If you have retinopathy due to diabetes, no matter what glasses they try on you, your vision will not improve. We need to treat the underlying cause. So it's important as ophthalmologists, we do a very detailed examination. So we check the patient's acuity, and then we check them for any refractive errors. And then the important thing is there's dilated fundus examination. Okay. So we put certain eye drops. With a dilated pupil, that's the only way you can actually have a look at the
those
retina.
are the drops, but as children we used to put them, and they used to tell us don't read for a while, and we'd be so happy we don't need to read for a while.
Exactly, those are the ones. And then there are certain machines, we take pictures of the retina, and then we can, so that we can compare on an annual basis. So this is an exact science which has evolved over time.
So is there any pain associated, like retroorbital pain or some kind of pain with any of these?
Generally, no, pain is not an important feature. This is the dangerous thing. For example, in glaucoma, your eye pressure will be raised, and very slowly it is eating away your vision. It's damaging your optic nerve. So unless you go to an ophthalmologist who, again, many a times the ophthalmologist will not actually check the eye pressure. Again, it's a matter of screening. So it's very important that all diabetics, and if you go to an eye doctor, just ask them, can you please check my eye pressure as well? So many a times there'll be no pain. So this is the problem, that your vision, you will become aware of your visual loss once the damage has occurred.
So, even during COVID, it was known that there was a symptom called conjunctivitis where the eye got red and it got swollen and it was infected. And as you were mentioning that, even in diabetics, they get recurrent infections and infections don't heal. And people, when they get infections, they start using steroid eye drops. So what would you say about that?
Yeah, no, these medicines are, these are serious drugs.
Right.
And we don't advise self-medication at all. Steroid eye drops are important for certain conditions, but then they can actually have side effects. They can actually cause cataract and glaucoma.
Right.
So these are double-edged swords. So on one hand, medicine helps, but then worldwide, I think one of the leading causes of death is medicine itself.
Exactly. So, and with the weather, it was very, very dry lately, and people had a lot of dry eye, and then they have more dry eye because they're glued to their screens these days. It's like online, everything is online, whether it's education, whether it's entertainment. So and they forget to blink even. So what do they do for dry eye other than those tears and all of that?
So for dry eyes, these over-the-counter artificial tear medications, they're very safe because they don't have any active drug in it. So we do recommend that if you feel grittiness, and if your job is, if you have to sit in front of a screen for a long time, invariably you will get a dry eye. So you can just go to a pharmacist and buy over-the-counter artificial tears. But in some forms of severe dry eye, you do need certain other medications. So I think you should go to an ophthalmologist so that they can examine you. And then
people have a flu and they're like sneezing, they have like watery eyes, and then they have these pollen allergies where their eyes are extremely allergic. What do these people use, like antihistamine drops after going to a doctor?
Yes, again, if you are prone to eye allergies, so you need medicated eye drops. And then there are different categories. There are topical antihistamine as well as topical steroids. I have some patients who have very severe eye allergy. And in Islamabad, the allergies are very common anyway. So I have loads of patients who keep on coming to us. So you need to know which seasons this flares up, and then during those, often we need to intervene. It's not a case that you can just start using drops at home yourself.
And how bad is rubbing the eye? Like people have this practice of constantly rubbing the eyes. Can it actually damage the eye or cause some kind of tear?
Very good question. Severely. Eye rubbing is, we dislike that a lot nowadays, because studies have shown just by rubbing your eyes, you can actually damage your cornea, you can thin your cornea. There are certain, in some cases, children who have very severe eye allergies and their eye rubbers, they eventually have very thin corneas and they could develop a condition called keratoconus. So cornea becomes so thin, it can just become cone-shaped. So if you see your child, they have uncomfortable eyes, they're rubbing, they need treatment. They need to be seen by.
And if they're squinting, they're trying to, strain their eyes, then we need to take them to a doctor as well to check their refractive error.
All these common sense things. Parents are very sensible nowadays, and even teachers at school. So I have an interest in pediatric ophthalmology as well. So I see a lot of kids coming to my clinic. So the parents or some adult has seen that the child is standing very close to the television.
Yeah.
Or they're squinting and they're struggling with their vision. So these kids need a formal check.
So what about this eye makeup? A lot of people are wearing these artificial contact lenses and then fake lashes and that glue getting inside and mascara and all of this. So how harmful is this for the eye? Because a lot of people are using it.
I think we have to be very careful with these products. I think I will not ban this, otherwise I'll become very unpopular with the ladies in town. So I think
proper hygiene, proper care.
Yes, I mean the thing is, as far as cosmetics are concerned, you need to make sure that you buy some good quality cosmetics. They should not be expired, because often ladies buy things and then they've been using them for a long time. So these are chemicals and they will react on your lid. There's this condition called Blepharitis, which is lid margin inflammation. There are tiny glands that produce oil and that help us with the eye wetting. So if you use very heavy makeup, then eventually you will get blepharitis and you will get dry eyes. If you use cosmetics, you should remove it properly, and you can always use artificial tears to afterwards, so that you don't get dry eyes. And these contact lenses, again, they have very serious complications.
A lot of people have corneal ulcers due to contact lenses, and then they start using steroid drops, which are contraindicated. So could you please tell them not to self-medicate, not to follow people on the net who are suggesting these drops?
Infection due to contact lens is blinding. You can lose your vision, you can lose your cornea, you can lose your complete eye, actually.
And they start using other people's contact lenses and other people's makeup. How bad is that?
That's really bad. So the trend is nowadays towards daily wear contact lenses, so that there's
disposable
disposable
ones. So like your mask, so
you use them once a day and you just throw it in the bin, because the ones that were being used for 6 months or 1 year extended, they're just very unpopular nowadays. No one can keep them that clean. If you are using, say, monthly or bi-monthly ones, then you must clean them very properly. You must make sure that you use the proper cleaning solution. And again, the wearing time, there are some young people who will just put them first thing in the morning, they will remove them last thing at night, they will take small naps with the contact lens. So this can really cause serious infection. If you are a contact lens wearer and if your eye becomes red or sore, you must go to an eye doctor. Don't self-medicate, because unless we actually examine the cornea on the slit lamp, you may have an infection in which you need proper antibiotics. If you use steroids in that case, that's going to be counterproductive.
Exactly. So coming to the foot care now, it is so important, and it's really tragic when you see these people ignore their foot so much. So what else, what other conditions other than an ulcer or a wound do you see in these kind of diabetics who come to you with a spoiled foot, for instance? Like, is there any other changes?
Yes, there are structural changes.
Okay.
Because diabetes, as I said, affects across multiple systems. So if it affects your blood supply, then you're going to have black spots in your foot, and then because of that blood supply problem, you're also going to have neurological problem where your nerves are going to get affected. They're going to effectively die, and then you will have lesser sensation, but at the same time, if your autonomic nervous system is disturbed because of that, then you're going to have problem with the
balance as well?
The balance of the muscles, and then you're going to have deformities like clawfoot.
Okay, so does it really happen that way, that a muscle, a part of it atrophies and a part hypertrophies, so one is built more and one is less, and then there's a disparity? And do you fix those things? Like, for example, if somebody has that kind of discrepancy or disparity in their
You see, there is a difference between a podiatrist and a podiatric surgeon. So I'm not really a surgeon. So we are podiatrists, and we usually take care of the preventive side of the foot.
Okay.
And for that, we give special orthotics that you can put inside your shoes so that the pressure, the abnormal pressure that, you know, our foot is, there are specific areas where our foot is bearing weight.
Right.
Right?
Yeah.
On the heel and one or two more parts of our foot.
Exactly.
But when we have a foot change, a structural change in the foot, then of course there are other parts coming under the weight bearing that are not really meant to bear weight. So you give
that, you know, that egg carton kind of a thing, that foam,
more or less, yes.
All right.
All right.
So
I think we've come a long way from those kind of things.
Okay, that's all I know about.
But but you're right. You know, the concept is the same, and we once again we alter the alignment of the foot so that, you know, those areas which are bearing abnormal pressure now should be offloaded once again, as I said. You know,
so how important is moisturizing in this? Because, you know, a lot of moisture and a lot of sweat, if caught between the foot, causes fungal infections. And if you don't do that, and a lot of drying is going to cause eczema, right?
Absolutely.
So what do you suggest? Do they need to, you know, apply some kind of emollient and keep it like moisturized yet dry, or they need to, you know, not apply it?
Yes, it's a trick that we have to do, you know, when we are applying creams on it. So first of all, if you are diabetic, for example, you're going to have problem with sweating because your sweat glands will be affected, and then definitely you're going to have eczema and things like that. So what you need to do is moisturize, but at the same time not moisturize the webs of your fingers.
So not inside these spaces.
Absolutely.
All right.
When you do it in the web spaces, then there is a chance that you're going to develop fungal infections.
Yes.
Yeah, because there's you know, the
stays
fungal
there. The moisture stays there.
Absolutely.
It's warm.
Moisture. It's warm and it's dark.
Right.
You know.
Yeah.
So darkness is the main thing, the reason why, you know, the fungal infections.
Then a lot of people apply steroid creams here. So could you please tell them as well, because, you know, it's diabetes and then steroid creams, further thinning.
I think before I delve into that, I would like to mention one more thing, and I think Dr. Tahir is going to agree with this, that diabetes is a multifaceted problem, and you have to have different specialties under one roof that will take care of it. Okay. One person is not going to treat everything. So I cannot really claim that if somebody comes to me, I'll be able to treat their diabetes and their eye problem and the foot. You know,
thank you so much, Dr. Salim, and thank you, Dr. Saab, Dr. Tahir, who shares my name. Thank you very much, and we have today covered from head to toe. So the eye and the foot is all covered, and I hope all of you have a blessed Ramadan and take care of your diabetes status, your sugar levels, as well as your eyes and your feet. Thank you for watching. Allah Hafiz.